The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
How do you translate what a patient's saying into what I can achieve as a plastic surgeon, specifically the natural breast augmentation? What do you really consider a natural breast?
Yeah. And, sometimes I do have patients that come in, they're like, oh no, I do want that really round, really augmented, like clearly fake look. But most of the time, that's not the case. Most patients come in asking for natural. And that's when we really try to get in their minds, because I think to you and I, a natural breast is one that's a teardrop shape. There's more volume at the bottom of the breast than the top. Your breasts are not pushed together, so you don't have cleavage when you are out of a bra standing there, and nipple position can vary a little bit patient to patient. There's all different types of nipple position and breast shape. But that, I think that's what you and I think of. How would you define it?
Everything you said, and the other tweak is we're talking about natural breasts, in other words, no support. So with an underwire, with side pushing in, that is a nice look, but that's technically not natural. So breasts will separate and they will drop slightly with no support. And even though you and I think that that's a natural breast, I think what a lot of patients feel is, hey, with a low-cut dress, with a special blouse, with a special outfit, I would be able to push them up, push them in, and have some cleavage. I don't necessarily want to live my life like this all the time, although some patients do want to live like that all the time. So this is why having a natural look, but being able to have cleavage without having an unnatural look, unnatural touching together, symastia, all those good things. I think that's what most patients want, but I have to figure that out, and so do you during the consultation.
Yeah, so we have to get in the patient's head, and then that's one of the, I ask the same question. So do you want to look like you're in a push-up bra all the time? Some patients, they're like, yes, 100%. And I would agree. I would argue that that's not natural, but it is a look, and it can be a very pretty look. And I always remind patients too, it's like, hey, not only is that the look that you're going for, but do you want to look like that all the time? Because you could choose something that was more of a teardrop, a smaller volume breast implant. And then if the dress calls for it, or it's Saturday night and you want to amp it up a little bit, you can always put a push-up bra with underwire on top of your breast augmentation and create more of that cleavage for that moment, but not have to look like that, Tuesday at 1 p.m. So
Yep.
That's also an important distinction for patients, because then, a lot of times they're not thinking about the fact that just like with unoperated breasts, you can also choose to enhance or minimize with lingerie and clothing. So this is why you and I were talking about this episode in advance, but inspiration photos help so much, because that allows us to really get in the mindset of the patient and understand what natural means to them, because that term is used so loosely when we're talking about breast augmentation.
Yeah. So one of the big things we think about as plastic surgeons is natural look. So one of the things, of course, is cleavage, how full the upper pole, the sort of top of the breast look like. Another thing you mentioned is the nipple position, because sometimes I get asked, I don't want the look where the nipples are a little too lateral, too much to the side. And what I explain to patients is some of it's genetic. Some of it's definitely maybe the implant is placed too much in the middle and it's pushing the nipples out to the side a bit too much. And I guess the final thing is, honestly, it depends on the camera lens. So a lot of amateurish, non-professional photos, they may have selfie on, they may have photographs taken by their friends with the smartphone, but that's not a true nerdy macro lens with no distortion, which is what we like as plastic surgeons.
Right. And then we see this all the time with, oh, I don't look like this in photos. And they like, oh, how do you like yourself in the mirror? I like it, but not in photos. I'm like, well, we're not chasing virtual reality, at least yet. We like to chase reality. But to your point, putting a breast implant in is kind of like putting a magnifying glass on the breast. So if your nipples are already a little bit out to the side, you have to put the implant centered on the breast itself so that looks normal, but that's going to kick out the nipples even more to the outside. Or if they're a little bit up, a little bit too high, again, we'll amplify that, or a little bit too low. We usually actually see the nipples rotate up, but certainly to the middle or to the outside, unless your nipples are right in the center of your breast and you have perfect breasts, they're going to be moved a little bit in some direction, especially if you're choosing a larger breast implant. So that's something that's important to consider. And your plastic surgeon, like Dr. Kim or I, would make sure we choose an implant that really fits the width of your breast so that we're minimizing that kicking out. Like Dr. Kim you were saying, if you have them too close to the center, that will even more especially shoot the nipples out to the side.
Thank you for joining us on The Beauty Scientist. Be sure to visit thebeautyscientist.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.